All right. Good afternoon, everyone. Thank you very much for taking time out of your day to join us today. My name is Meredith Marsh. I serve as your Quality Improvement Officer here at Health Choice Network. We are excited to have you join us today. We know you all have been in the midst of UDS reporting, but really thought the timing is very important as we move forward to introduce some new functionality that Greenway is going to be providing to our health centers. So with that, I am going to pass it off to our Greenway team. We hope you'll stay on and we will be able to answer questions at the end of today's session. With that, I will pass it on to you, Alex.
Thank you. I'm very excited to be here speaking to you all about Greenway Insights today. If you haven't heard about Greenway Insights, really our sort of go forward analytics reporting solution that we are going to be using here at Greenway. And I'm going to get into a little bit about what it's going to do. Regulatory reporting is the first module we are putting on this Greenway Insights platform. And what that means is that for 2020, that is the product that electronic clinical quality measures or ECQMs get reported on. So for Medicaid PI and for MIPS reporting, all the quality reporting comes out of Greenway Insights. Of course, energy practice analytics isn't going away. At this time, you still have it for your promoting interoperability, your PI measures, and everything else you use it for aside from ECQMs. Now, as we add more and more functionality into Greenway Insights, features are going to start coming out of practice analytics and moving into Greenway Insights, so we don't really have the overlap of having the same feature in both. But for 2020, it is just the ECQMs. That might beg the question, what is it going to mean to my practice? What is it going to mean to HCN to have Greenway Insights, because it is a new product? This is it can be thought of as an enhancement for all of our regulatory reporting as it moves over. So there is no cost to Greenway Insights at this time. Any functionality that is just a replacement for energy practice analytics or an enhancement over what energy practice analytics had, there's no cost associated to that. In future years, as we work down the roadmap, there will be new modules. So that's kind of the idea of Greenway Insights, is that we'll be offering ultimately new functionality, new features, new abilities that Greenway hasn't offered before. Things to let you really optimize the way you run your practice and get deeper into what's going on with your patients and your population as a whole. And when those new modules come out, those will be available, for additional cost if any customer, HCN, wants to take advantage of that. But right now, any reporting functionality, that there's definitely no extra charge for that. What does Greenway Insights do today? So right now we are actually on our .2 version of Greenway Insights. That's the version that's in the field right now. Greenway Insights has 16 ECQMs available. So I know in the past in energy practice analytics, there have been different numbers of measures available for different years. Right now in Greenway Insights, there are 16. That includes the dashboard functionality, for our MIPS practices, the QRDA submission that's needed to submit to MIPS, and any other program that uses quality reporting, so PCMH, ACOs, things like that. So those 16 measures are certified. They're good to go for 2020. In this .2 version, measure results can be seen per provider. So I'll get into what's coming down the line, but right now in our .2, measure results are specifically at the provider level, so it doesn't really have the practice as a whole quite yet, just each provider individually. And you'll be able to see your results for that provider, how they do on each measure, and then drill in and see what patients do I have that are affecting these measures, which patients are hitting the numerator, which patients are failing, which patients have exclusions, and go in and see the data of why that's happening. Our .3 release is the final planned release for the 2020 reporting cycle before we quickly transitioned it to 2021. So in .3, we have our grouping options. So for practices that need to have providers report as a group, if they're doing MIPS, or you need to see your whole practice as a whole, or if some practices may have data separated by service center. That's what .3 will provide, all of those groupings. If you need those groupings, .3 will be what you need to report. If you don't need those groupings, that's great, you're good to go today. And you can still use .3. Now, the way Greenway Insights works, it's a little different than Energy Practice Analytics. This is a cloud-based product. It's accessed, through your internet browser, just like any other website you go to today. So this isn't something where we are installing updates as they come out. They're sort of broadcast to everybody that has the product. So the days of sort of waiting for that next version and having to schedule and have your system go down overnight while we upgrade, that's not what Greenway Insights will be like. It'll be once we have that version ready, it goes out and everyone that has the product gets that upgrade. So there are a few differences from Energy Practice Analytics, and we'll talk a little bit more about them later, but you will notice that the ability to filter the dashboard works a little bit differently. So you won't be able to change the date ranges you're looking at on the fly. So if you're used to an Energy Practice Analytics looking at January and then maybe looking at February and just switching between dates, at this time that's not available. It'll sort of be a single date range that's set up to do that, and that could be changed for future runs of the data. Another change is that grouping. So again, for any of you that need to look at certain groups of data, that gets set up before the calculations are run and can't really be changed on the fly. And I think we'll talk a little bit later about how that will all get set up. So the next slide, as you already saw, is just a list of the 16 ECQMs. Of course, I'm not going to go through them, but you have these to reference after the presentation. So the next slide, I'm going to go in and we're going to see a live demo of the product, but before we get into it, I do just want to hit on a couple of the key points and have these screenshots out here again so you can reference them later. This is the measure dashboard, so this is kind of a snip of just that measure performance area. So you can see you have a few filters, your measure filter, population filter. So if you take a look, CMS 155 is a measure that has multiple populations and multiple stratifications contained within that measure, so I'm viewing all of them. That next filter up there is the provider filter, so I can switch between my providers, and you can just see kind of a very simple layout of your denominator and numerator view, and I'll go into these in a little bit more detail in the demo. So the next slide is going to be a little bit different view. This is your patient view. So when you're looking at your patients, pretty straightforward. What is their basic information, their first and last name, that patient ID that you can search for back in the EHR, and then you can search your patients as well. So next slide is our care gap screen. So this is that area where you can see why patients did or did not meet a particular measure. So you can see here I'm highlighted on CMS 122. And you can see the data that patient has associated to that measure. You can see which parts of that they're hitting. They're hitting the denominator, they're hitting the numerator. And we have a red X, and that's because CMS 122 is what we call an inverse measure, where you actually want patients not to be in the numerator. So we have a nice red X saying that the patient is failing to meet the measure. So on the next slide, I want to talk a bit about the reporting path. It is obviously different than we're used to in previous years because there are a couple different products in play. So as a reminder, promoting interoperability measures are still being reported on through Energy Practice Analytics and the operational dashboard, just as they always have. But here in 2020, the quality measures are reported through Greenway Insights. So that means that if you're compiling your Medicaid or your MIPS reporting, both Energy Practice Analytics and Greenway Insights are used to get your final report, because those two different sets of measures come out of the two different products. And of course, in future years, the ultimate goal and the whole point of Greenway Insights is to make everything consistent. So in future years, we are going to have all of our regulatory programs all move into Greenway Insights, so we're not working out of two products. But again, that's not going to happen until all of our, we've met what Energy Practice Analytics provides and exceeded that. So once we're there, we'll move everything over and there'll be only one product. And then on the next slide, just one more note about something you're going to see in Greenway Insights. We do have a new way of displaying errors. So as we load our data into the Greenway Insights engine, if we detect that there's something wrong about a patient or more than one patient, we're going to display an error. And these errors, for the most part, they're informational. They're telling you something like, you have a patient that's missing a date of birth, so we couldn't use them because the measures require a date of birth, or maybe the dates don't make sense. The date on a problem doesn't make sense, something like that. So these are informational errors. They're not all going to be a problem. But if you do have a new error that you haven't seen before, you can use your regular escalation path to report issues up to Greenway, so we can investigate and see if they're affecting your measure results or it's something that we need to take a look at. So with that, I'm actually going to go ahead and jump into the demo of the product. Greenway Insights is a browser-based product. So if you haven't already seen it, all I have here is I have my URL bookmarked. So it's that easy to access Greenway Insights. So I hit my bookmark, or however you end up accessing it. Here's your login. So here we are. This is the dashboard. So the first thing you might notice is that nice red bar telling me that there's an error. So this is going to be what I was just talking about, those patient level errors. So if I click right here, it's going to bring me to the error summary. And again, if these are new errors, you could report them up if you expected to see them because they've been there, you've already reported it and you understand that they are, that's okay. So what these errors are telling me, they're a little technical and hard to read. This is something we're working to improve. But these errors are telling me that I have a bad date. So actually in this case, I have a patient problem and the end date is before the start date. So obviously that's not going to really work. So we're throwing an error and we're not letting those patients kind of pollute the measure. So that's why they're over here isolated from the dashboard. So that's your error summary. Hopefully you don't see too much of that, but I did just want to point that out if you do load up your dashboard and see that red bar. So back here in the dashboard, when you first come on, every time you log in, it's going to be empty. That's because, as I mentioned, this is a provider-based view. So before I see any results, I'm going to need to pick a provider. So how I do that, obviously I come in here to my provider dropdown. Now this is our data created by our internal users. They name all their providers based on the measure they want to test, but these are providers. So if I go and I pick one, I can apply that filter, and now I see my performance for that provider. Again, as I mentioned, I have all populations displayed, so I see 155 show up, for each population, and I can scroll through all of my measures, or I can go ahead and pick one. So maybe I'm concerned, I just want to see how I'm doing on colorectal cancer today. So I can come into my measure drop down, pick that. So now when I apply the filter, I'm only going to see that one measure. And I can see my denominator, my numerator, my overall rate, my exclusions, of course. You can also see here, for this practice, I do have a date range configured. So this must be the 90-day period that I'm reporting from. So whatever the date range is, you will see it here on the dashboard. So now that I have a measure selected and a provider selected, here are all the patients that are included in that measure. So if I had left all measures selected, I would see essentially all patients that the provider interacted with in that period. But if you have one measure selected, I'm going to see only patients for that measure. A few things I can do here. Up here, I can filter by the initial population, denominator, or exclusions. Of course, if I wanted to see patients that were, in the numerator, I could filter down to the numerator. If I wanted to see patients that were not meeting the numerator, of course, I have non-numerator. One thing you'll notice that's a little different from energy practice analytics is the care gaps column. So eligible measures and care gaps tell you how many measures, based on what I filtered to, does the patient hit the initial patient population for? And then of those measures, how many care gaps do I have? And a care gap is going to be any time that I'm not successfully satisfying the measure. So in the case of this Amanda patient, if I click in, what I see is I don't have a numerator, but I do have an exclusion. So we're going to consider that a care gap because I haven't met that numerator condition, although the patient does have a denominator exclusion. So when I look in to see maybe why does the patient have an exclusion, I get to see all of the data that's contributing to this measure. So when I'm on the IPP tab, I can see that there are two components to the IPP. They need a certain age and a qualifying encounter, and the patient meets both of these, as I can tell by the green check mark. And then I have, why did they meet it? Looks like they had 3 visits. You can see the code of the visit, the date of the visit. If I hover over the code, I can also see the description. So this is going to be that procedure code's description back in energy. These obviously get rather long, so we put them in a hover, just when you hover over that code. As I flip through the rest, in this measure, the denominator and the IPP are the same, so I see the same information. Over here, denominator exclusions, now I can see why this patient is hitting the exclusion. Clearly here, there are a few different possible exclusions for this measure. This patient happens to meet the frailty exclusion. So why did they meet it? Patient is greater than 65, less than 80, and they have some frailty data. And when I look at that frailty data, I can see that it's based on the encounter and based on the device applied. So I see what is that device applied. This is going to be another difference from energy practice analytics. Whenever you see a code followed by a code in parentheses, that code in parentheses is going to be your medicine ID. So if you added an encounter finding into your note, that's what's going to show up here in parentheses. And then the other code is the code that medicine finding maps out to, which qualifies the patient for the measure. So this is the code. It could be a procedure code. It could be a SNOMED code or a LINK code if you're familiar with those code sets. That's what the measure looks for. So we're going to display that as well. And again, when I hover over it, I can see that this patient has a cane, which is what is qualifying them as a frailty patient. And then I can keep clicking through. This measure has no exceptions. And then in the numerator, I can see all the different numerator options, and the patient did not meet any of them. So obviously they are not in the numerator. So that's really how you go in and look at your patients and can validate what you're seeing and that the patients are, the data you entered in the EHR is showing up in the dashboard as expected. So again, if I come up here and I want to start over, I can clear my filters, select maybe a different provider, and apply those. So if I have this provider selected, now I have a new set of patients because I'm going to see the patients that that provider saw. If I filter this down to look at numerator patients, and I click on this patient, I haven't filtered down to a single measure. So now what I'm going to see is all of the measures that the patient has hit the initial patient population for. Again, all of these measures are going to be based on what I have up here. So if I have all measures selected, I'm going to see all of the measures that they, qualify for. This patient does hit the numerator for 122. And again, as we talked about before, this is one of those inverse measures. So you can see the information applied during the numerator here and why that's a bad thing. So they had a visit, they had a diagnosis that qualifies them for the IPP. And if I skip over here to the numerator, I can see that the patient has no record of HbA1c. This is the diabetes control measure, so I want to have that HbA1c test. Because I don't have one, they're in the numerator, that's a bad thing. So we do give that red X. So that really is the dashboard. Right now, there's not, a ton of functionality in it. We really wanted to kind of cut down and for this first release, make sure we give the information that's necessary to not only report, but also investigate your data, dig into it, make sure that everything looks right, and you can go back and make some improvements with your data if you need to. Now, for those of you that are reporting to MIPS, of course, there is one more step, and that is your QRDA submission. So that's going to happen here with the export. So if I wanted to use this provider to report, and I wanted to report on 6 measures for MIPS, what I could do, come into my measure dropdown, and I would select the 6 I want. We'll just pretend, it's these 6, apply that filter, and then export. When I export, I'm going to be exporting only the measures and the provider that I've chosen. So make sure you go ahead and hit the 6 that you want. Go into export. Of course, we want to create a QRDA3. The QRDA3 is the submission file. So I would hit the QRDA3, continue. I'm testing with this provider. I get the NPI, the tax identification number for the practice, and I can start my export. This could take a while. It might not, but it's going to run. I can minimize this and continue looking at my dashboard while that runs. And while that's running, I'm free to go look at another provider. It's not going to affect that export because that's already been kicked off and it's running in the background. So again, as I said, we're really getting straight to the point at this juncture with Greenway Insights. You can see my file is ready. I could download that and then go ahead and submit, but I'm not going to go through that right now. Right now, the dashboard is kind of straight and to the point, giving you the results, giving you the data that are contributing to those results. And as this product evolves and progresses, there's going to be more and more coming in. As I mentioned, not just other regulatory reporting programs, but also other modules, those reports that you might be using to look at daily to manage your practice. All of those things you're used to and a lot more. Pulling in data from other Greenway products if you're using the Greenway patient portal, things like that. So really putting a lot right all into the same place so you can really see what's going on in your practice. So with that, that's really what I wanted to show today. Thank you for letting me walk through and kind of show Greenway Insights. We're really excited about getting this out and progressing through the life of this product. So I hope to be able to show you more in the future. But for now, I'm going to hand things back over to Melanie.
Thank you so much, Alex, for passing it back to me. And let's just get started here. So, hi, my name is Melanie Thomas. I am the Learning and Development Specialist here at HCN. I've been with HCN for about 7 months now. And I come with 6 years of experience in designing, developing, and implementing training and development programs for software. So as we get started, Greenway Insights will be accessed through the published application. An HCN member experience will create 2 Greenway Insight admin accounts for each of the health centers. And the strategic partner services will be reaching out to each health center immediately following this webinar to obtain the name of the Greenway Insights admin. So once an Insights admin user is created, they will have the ability to create additional users moving forward. And the center admins can set the user rights either as another admin or as a regular user. So the admin rights will allow for you to add admins and users, as well as change those date ranges for your measurement calculations as discussed by Alex. But for all other support issues, that should be members via Service Cloud ticket. And like with all ticket submissions, if applicable, please submit supporting documentation or screenshots that will assist in troubleshooting. So promoting interoperability in Greenway Insights. So all providers must report on a 90-day CQM reporting period, and all providers must report 6 CQMs related to the scope of the practice. In addition, Medicaid eligible providers are required to report on at least one of the outcome measures. If no outcome measures are relevant, the EP must report on at least one high priority measure. And if no outcome or high priority measures are relevant to an EP scope of practice, they must report on 6 of the relevant measures. So when you're selecting your 6 ECQMs, you're going to do that. And then as Alex was showing, you select the population and then the provider. You'll apply your filters to view the results. It's important that you save a screenshot in PDF format in case of any auditing. Also, with the patient examples, there is an ability to export to Excel. But this export will give you the patient's name, ID, date of birth, but it's not dependent on the filter selected. So for the details, you're going to want to take a screenshot. Click on the patient details and take a screenshot of that for your records, just in case of an audit. More documentation and resources is available. So within the Greenway Insights application, you're going to see a question mark, which will lead you to this help menu. Inside here, it'll give you walk through some utilization, not only as a regular user, but then also on the admin side. It'll also go through each of the CQMs that are available through Greenway Insights. There's also the Regulatory Resource Hub, which not only gives more information on regulatory programs, but it is also a dedicated section of how Greenway Insights relates to reporting with videos and other information. I'll now open it up for questions for our panelists via the chat.
Thank you so much, Melanie. So we do, in looking at time, have a few questions in the chat box. So we will divide and conquer here. The first question we have is, will we still be able to get patient level detail from Insights, and will we be able to download it? Greenway team?
Yeah, thanks. I think Melanie hit on it, but I will expand on it a little bit. For downloading the patient details, what you're going to be able to do is download that sort of the patient demographic information that we display. That will be able to be downloaded to Excel. Unfortunately, at this time, the like the measure results per patient or the supporting detail per patient that we show in the care gaps area, that is not able to be exported into Excel or downloaded in any format. So as Melanie stated, HCN's recommendation and Greenway's recommendation is to take screenshots of that relevant information that you want to keep in case of an audit or just for your own records. We always recommend that you keep screenshots of your dashboard and your results. So at this time, that's the only way you're going to be able to save off that information. It's definitely something that we're working towards to add in the future, hopefully the near future. But as we're able to add that in, we'll definitely be letting the HCN team know and letting you all know that that will be coming.
Thank you. The next question we have is, do we have access to Greenway Insights now? How do we get to it, and what credentials do we use? So hopefully you've heard the message just recently presented. You do not have access, but our HCN team will be reaching out to your team following this webinar to get you set up. Next question, in the future release, will more details be shown of how the patient qualified for the denominator and numerator? Greenway?
Yeah, so we're definitely going to be, obviously this is a new product that's been out in the field for a very short amount of time. We're going to be evaluating, what's working well, what's not. Just like we've taken, enhancement requests in the past, we're going to be continuing to do that, ask, what's successful. So if there's something where information is lacking and details are lacking, if we get specific, requests about what can be added to make that a little bit more clear, we're certainly going to be looking to act on that kind of feedback. So use your escalation channels so we can hear that. We definitely want to make this as useful as possible.
We have a few more questions for the Greenway team, Alex, so I'm going to roll off a few more. What is the timeline for being able to change date in real time?
Yeah, that's definitely, we understand that, losing that functionality it's a kind of a big change, and depending on, how the practice is used to reporting, it can be a very impactful change. Right now, I don't necessarily have an exact timeline for when that's going to come. It's definitely something that we are, looking at Greenway. We're looking to add in as soon as we can. I will say that the reason it's not available is not because we didn't want it, but sort of a technical limitation of our first iteration of the product. So again, that's one of those things we definitely want to keep improving, and we're going to be looking to bring that back as soon as we can.
The next question, does each qualifying visit where the measure wasn't met count as a care gap?
So what's going to show up in the care gaps are data that hit the value set for that measure. So for example, in the initial patient population, a given measure might have 3 or 4 different value sets for what a qualifying encounter is. So what we're going to show is any encounter that matches one of those codes. So if it's a 99201, something like that. Even if that 99201 maybe falls in a time frame that is not being considered, say if the visit has to be compared to a diagnosis, and this particular visit happened before the diagnosis was made, those are the ones we're going to show as a care gap, because yes, it was the right code. No, it didn't happen at the right time. We're not just going to show every encounter that happened, because we're only going to show the encounters that have one of those qualifying values on them. And that's going to be true for every data type. So as long as it hits the value set, we're going to display it. And if it's during the year, so we're not going to display something that happened 10 years ago that's irrelevant to that measure. So if it's during the year, if it has the right code, then that's where we'll show the data and whether or not it's hitting.
Thank you. And there's several questions here regarding exclusionary criteria. So for our HCN members, we will make sure following this webinar, as your team is gaining access, that we're providing some resource guides and more information so that your team is fully versed on these areas. The next, scrolling down, who gets insights again? So this will be provided to your admin users. Our team will be reaching out, and then we will be working with you to look at how that access is granted internally. Let's see, the next question we have for the Greenway team, is the date specific to the user, or all users from one practice have to use the same date?
Yeah, at this time, the date is specific to the practice. So everyone in the practice will be using that same date. Again, I think HCN will be helping to set that up and maybe speak more to the strategy of how that will work. But yes, the date is specific to the practice at this time.
Okay. The next question for Greenway, Alex, thank you, is can you select multiple providers at once?
No, in this release, you will not be able to select multiple providers at once. In our .3 release, which is, we're preparing it for a March release, you will get that ability back. So in that .3 release, you'll be able to select multiple providers, as many as you want. However, that's going to be something that's going to need to be set up again ahead of time. So you'll be saying, okay, I know I'm going to want to view these two providers together. So before I run the data for the next day, I'm going to tell the system that these are the two I want to see together. And then that will basically join the list of providers. So I could see the one provider by himself, the other provider by herself, or those two providers together. So unfortunately not available now, will be available in .3 with a little bit different experience than you're used to in practice analytics.
Thank you. The next question, are there any financial reports included in Greenway Insights?
Nope, not at this time. Greenway Insights is only the ECQM reports. Certainly, as we roll forward, financial reports will come into Greenway Insights, both financial reports that are in practice analytics today, and some new reports, and maybe some more intuitive and deeper looking and advanced reports. So those are all things that again, we have a few different initiatives happening here at Greenway Insights. Regulatory reporting was that first initiative to come out, but financial insights is certainly something that we're looking to move into pretty quickly. It's high up on the roadmap. So as more information about that is available, we'll certainly be sharing it. So definitely something to look forward to.
Great. The next question, can we export data on patients' performance versus measures in bulk like practice analytics can?
Unfortunately not right now. That's something that we're looking to add in, so that bulk export not available today, and not going to be available in that .3 release. But we are looking to see when we are going to be able to enable that. We've definitely heard it. It's a requested feature, so we are looking to add that in.
We have a few more questions on the date parameters. So I don't know if your answer to the last question. There's a question here on if the admin user has to set it every day. How does the date parameter work?
Yeah, the date parameter is it does need to be set before the data loads into the system. So if we have a nightly load, then that date would have to be set before the nightly load runs for the next day. So yes, you won't be able to set it and then have it take effect later in the day.
right? The next question here, is there any way to merge additional data elements into this report for prioritization purposes, such as a risk score or other information from a third-party source?
No, not going to be able to do that in this iteration. That certainly sounds like something that we could look at down the line. Like I said, we want to do a lot of stuff that we haven't provided before, and those sort of features are definitely on the radar. So if that's something you'd like to see, definitely raise that up through. And we'll be able to put it on and look to see if we can get something like that in. But those types of, getting data in from other sources, that's sort of what Greenway Insights is all about, being able to access all sorts of data. So definitely something that we'd be interested in adding.
And then, as expected, I know there's probably lots of questions about UDS reporting, especially as our centers are just coming off. In the future, as Key is changing and updating, how will UDS reporting be integrated into Greenway Insights? Great
question. Yeah, in the future, we'll definitely be moving the UDS reporting into Greenway Insights. For 2021, I would look for UDS to remain in energy practice analytics. As we all know, it's a big process. It's a lot to collect and report on, and it's a lot to build in the software to get that reporting done. So I don't think it'll be coming in 2021, but certainly as we move on, we're going to be laying that foundation to get it in as quick as we can, so we can have everything in that single experience. But as we get closer to that, we'll be letting everybody know what's coming, when is it coming. But down the line, UDS will definitely be implemented in Greenway Insights.
Thank you so much, Alex. To our HCN members, thank you so much for taking the time out to meet with us today. We will be taking your questions. We see there's several themes to make sure that we're creating some resource guides and additional information for you all. The HCN team will be in touch so we can make sure you can get access to this tool and get your hands. I'm sure many of you are interested in diving in and getting into this tool. So with that, we will wrap up the session. Once again, thank you all very much for your time. Thank you for all that you do, and we will be in touch very soon. Take care, everyone.